So I'm going to kick it off here. And, what would you say if I told you there was a way to reduce your average call center times without adding a single member to your call center team? Would you believe that? Do you think that's possible? Well, let me tell you, the best part of this is that you actually don't need a massive tech budget or any type of data scientist to actually make those results possible. So good afternoon, good morning, everyone. Good evening, depending on where you're calling us from. So I'm Chris Grasso. I'm the founder of FASTx Partners. And today we're going to be talking about how you can make an impact on your healthcare operations. And just to let you know just quickly about FASTx Partners. So we are a organization that really focuses in the health center space. We also work with some software vendors as well. We really like to work with mission-driven organizations. We offer a number of types of services. We offer fractional services, which are part-time executive services. We also have advisory services and consulting services. And we really sort of span areas of expertise across all health center areas, from technology to cybersecurity to operations to population health, which is one of the areas that Lisa also has specialty in. So definitely reach out to us and see how we really can help and support you during some of these challenging times. So with that, I'm going to dive right into the topic with my associate, Lisa Tejada. So Lisa is a fractional executive. She's also a chief innovation officer. She's a nurse executive. She has 25 years of experience, really spanning across all patient care. She's worked in critical care centers. She's worked in FQHCs. She's done tons of implementation around health programs and population health platforms. She's currently the Chief Innovation Officer at Provider Tech, which is an organization that develops AI technology strategies. And I'm really excited to get going on this conversation today, Lisa. So let's just dive into this conversation. No more belaboring the process here. So there's so much buzz right now about AI, and I think it's incredibly overwhelming, and people are trying to wrap their heads around it, and they're beginning to hear more and more terms. For example, people are hearing terms like generative AI and agentic AI, and all these terms are popping up everywhere. And I'm sure people are wondering, like, what are these, and really, what's the difference between generative AI and agentic AI? And so can you walk us through that in plain English?
No, it's a great question. I agree. Whenever there's new technology, we hear a lot of terms. A lot of times they're used synonymously when that isn't the best case for these two words. So generative AI and agentic AI, while they have some similarities, the biggest difference is really how they operate, the level of autonomy or independence that they operate with. So generative AI is some of the things that Chris and I were just talking about. If you heard some of this at the top of the hour, there are things like ChatGPT, Claude, Gemini, Copilot. So you may have some experience with those. But what those tools do, they react to a user prompt or question, right? So they search across a number of databases across the internet. In my case, I was planning a vacation, so they were looking at reviews, anything they can have access to provide information to the question or the prompt that the user asks. Whereas agentic AI operates a lot more independently or autonomously. It makes decisions or takes actions based on predefined goals. So when you think of those two in healthcare, what does that really look like? So generative AI might be something where you generate patient education materials in a different language, or maybe with a certain health literacy level. Whereas agentic AI might be used in, and as you've probably already guessed, we're going to talk a little bit about call centers today. It might be used to help reduce that strain in call centers, and maybe the AI agent's top goal is to schedule an appointment or answer questions about the practice. And so those are the goals or tasks that it has, and it's going to operate independently based on the information that it's been trained with.
So thank you so much. That's a great breakdown, Lisa. And it's that you're laying such an important foundation, especially as we think about how AI can fit into some of the real world problems that health centers are facing right now, like tight budgets, smaller workforces, growing demands from like every which way at this point. So, and I think we're all hearing about lots of different ways that AI can really integrate into health centers, from clinical support to back-end efficiencies. But the area that we really want to zero in on today is the area of operations, and particularly the call center. So Lisa, can you just talk us through what you see as areas that are starting point for AI in call centers?
Yeah, absolutely. So you touched on some of the challenges that those health center call centers are facing today. And as you mentioned, I came from FQHC myself in the Phoenix area here where I live, and I managed our call center. And my team was amazing. They were kind and compassionate and patient, but the work was insurmountable on most days, right? We had hundreds and hundreds of inbound calls, and as the organization grew, that grew to thousands of calls each shift. And so even though my team was amazing, the overwhelm is real, right? The call volumes are high, working with patients and their needs is often difficult. And so the result is that there's high turnover in those spaces, right? So nationally, you see 25 to 35% turnover in call centers. And each time someone leaves, they take that training and that institutional knowledge with them. So you're continuing to start over. As Chris mentioned, shrinking budgets. The budgets in healthcare have always been a topic, but certainly we're all aware that we're in a very unique time. And so we're having to think about things more strategically than we ever have. And so how do we still deliver great care without the number of resources that maybe we've had? We know that it doesn't change the work. There's still the same amount of calls coming in, the same needs, but what the result could be is longer wait times and higher abandonment rates, right? Patients just disconnecting because they are frustrated and can't wait anymore, and certainly the staff. So I think this is a really exciting time to start to think about how do we bring new technology like agentic AI to address this challenge. And certainly in the industry, as Chris said, there's a number of things that we're seeing in the healthcare space, but the prediction is that agentic AI is going to be the fastest growing use case over the next year.
Yeah, it's unbelievable. I mean, it's like, I would say like a year ago, nobody was talking about agentic AI, and here we are, right? And it's really exploded in such a short period of time. And I think as you and I have talked about this and what we're seeing when we work with different health centers around the country and different organizations, we're seeing AI adoption, and oftentimes it's on the clinical side, right? Scribes or some of those areas, but we're not really seeing as much of an uptake in some of the areas of operations. And, as we all know from working in health centers, when budgets are tight and people are, thinking about having to reduce their staff, we're not laying off, clinicians typically, right? We need clinicians to see patients. We see the revenue generating, right? These are kind of critical positions. So oftentimes when we're looking at staff reductions, it's typically a lot in those operation areas. The call volume doesn't go away. The call volume is still there. Patients are still seeking care. We're seeing a population boom. We're not seeing population shrinking, the silver tsunami, where, there's all of these things that are putting continued added pressure onto the healthcare system. And so, I would love to talk a little bit more about the call center, and how, it's kind of a missed opportunity, I think, in some ways, or a great opportunity that it could be for an organization to really think about how to move AI into some of those operations. And it's not about, we're not completely getting rid of staff in call center positions, right? This is not about that. This is about augmenting it. It's about really being able to sort of provide staff with the support they need, but also provide the patients with the care and the answers they need as well. So I don't know if can you dive into that a little bit more?
Absolutely. I'm just going to share my screen real quick here. So I think you're exactly right. This is not meant to replace anything, but I always talk about, because I've worked direct patient care much of my career, and when you do work direct patient care, I joke that you're saying the same things over and over and over throughout the day. And that certainly happens in the call centers too, right? There's a lot of repetitive questions or needs, and those are very important to the patient that is on the other end of that line, but to the staff that has maybe answered a question like that, 50 times in a shift, that can, right? You're going to be a lot less enthusiastic call 50 than you are at call number 1. And so I think that the opportunity is really to take those repetitive or common questions off of the workload of your existing staff, your live agents, and supplement them with AI agents. So, a couple things that, we think about, we talked about the turnover, right? And as people are leaving, it's sort of a revolving door, and you're trying to maintain that quality where AI agents can be trained on your content, your scheduling guidelines, things, FAQs, things that are common to your practice. And so they can consistently provide that information and thus support your patients and your staff. We know the data says between 30 and 35% of inbound calls to a practice are related to scheduling, whether it's scheduling a new appointment or changing, rescheduling, canceling, et cetera. And so even if you just take that off the top, that's a tremendous reduction in that pressure valve release to your teams. And so I think the opportunity here is really exciting. The other thing that is really unique for agentic AI is that it is so conversational. So, we've all had the experience as users where we are calling in and we hit that phone tree. Press 1 to fill your medication, press 2 for this, press 5. 10 buttons in, maybe you get disconnected or you never get the resolution that you call for, right? That's a very frustrating experience. The difference with agentic AI is it's very conversational. It is, again, trained on a task or a goal. And so it's going to be able to answer questions that the patient has and redirect them towards that goal, whether it's scheduling or providing information about the practice. And if there is something that the AI agent isn't able to answer, it's trained to then escalate to somebody on the team that can provide that. And so when we talk about taking those common and repetitive questions and conversations off the workload of your team, now they're more available, both actually available to pick up a call, but not as overwhelmed to answer some of those more complex needs. So it is a really unique and exciting tool to augment and support your existing team and your patients as well.
Yeah, that's great. You touch on something that I would love to just spend a couple minutes on, and that's training your AI. So we hear this all the time, right? And of course, people are like, what in the world does that mean when you train your AI? So can you talk about how you would train an AI agent in your call center?
Absolutely. So when we're working on new projects with clients, we talk about you're going to train your AI agent, and certainly we're going to support them, but in the same way, with the same materials, you would train a live agent. So as somebody new is joining your team, you have onboarding material, you have operational workflow, scheduling guidelines, FAQs. Those are all things that are part of that training, and that new person is trying to consume all of that and learn and be ready on every call. We're going to use that same information and materials, and the AI agent is going to consume that, and then that becomes their knowledge base. The AI agent can also go to your practice website, right? There's often information about your bios about your provider. So maybe a new patient is calling in and they say, I'm looking for a Spanish-speaking female doctor, and I want to establish care with you. The AI agent could be able to access that information from either those training materials or from those bios and be able to say, Dr. Hernandez is available and I can book you with her next week. And so the training is not something that is going to require a large lift from the organization. They simply provide those materials to our implementation team, and the agent is trained with those.
Yeah, and that's really helpful. And this is probably one of the topics we could, dive into in a much deeper level, but I think it was really helpful to explain how that process works. So it sort of takes out some of that mystique out of it. But there are also just like a lot of other, I think, benefits of AI. You talked about, a patient who might have interest in a Spanish-speaking doctor. And for many organizations, it's hard to just staff for every possible language, right? So we have those scenarios that where AI can be helpful. Also, people take vacation time. We want people to take vacation time, right? It's an important part of the process, but AI doesn't necessarily take vacation time, nor does it sleep at night. So maybe we could just sort of dive into some of those benefits a little bit too.
Yeah, absolutely. I think we're sort of joking a little bit about taking time off, but we do want our staff to do that, right? We want them to have that time off and be replenished. The AI agent is always available 24/7. It's multilingual. It's also can deliver not only that content that we talked about training it on, but also at an appropriate health literacy level. So we're working with clients, we're operating in that recommended age range of 4th to 6th grade reading levels. And so the AI agent is speaking within that appropriate health literacy level. And so I think those are things that not only we can offer, but also, Chris, you mentioned the language line, right? Even if you have a bilingual team, which most call centers do, you can't account for every language, every dialect. You can't expect that person to be there in that moment. So while there are different language line tools, those are an additional cost to an organization, and they take additional time, right? You're trying to call up the language line and find somebody that speaks that language, that dialect. It increases not only the call time, but often the frustration for the patient on the other end.
Absolutely. I think it's a fantastic point. Okay, so let's say you've selected your product, you've trained your AI. So who's managing this within Health Center? I mean, you've seen this implemented across many organizations. So who's taking this on? Who are taking these projects on and making sure that they happen? We need somebody to still manage AI. We don't want it to go rogue on us. So tell me a little bit about what you've seen.
Yeah, absolutely. So as far as the owner within the organization, because thinking about, I'm talking a little bit about the AI agents that we have deployed, but for those of you that are on the call today and are thinking about this for your organization, these are some of the things that you should be considering. Your AI agent solution or platform should be so user-friendly that even someone non-technical could be the project owner. So, and that's what we see. We certainly see some IT project owners, but more often than not, we see operational or a front desk manager that is really the owner of this project within the organization. And so they are able to log into their platform. They're able to see every conversation, right? Having full visibility. Of course, because it's an AI agent, it provides a call summary as well. But also, you should be thinking about what metrics are going to be important to you. So in our platform, we're able to see not only the call summary, the entire transcript, but also was the call able to be handled end to end by the agent versus did it have to be escalated to a human to complete whatever the task at hand. And so all of those metrics are really valuable to evaluate how are your patients adapting to this tool and how well it's supporting you.
Yeah, I want to touch on the metrics. So okay, so now we've selected our AI, we've trained our AI, we've implemented our AI, we have somebody managing our AI, but we need to know that it's working. So can you give us a sense of like some metrics that organizations might look at to see if it's actually having an impact?
Yes. So it's a lot of the same things that you are looking at today in your call center, right? So you're looking at hold times, you're looking at abandonment rates, you're looking at the first call resolution, right? Does a patient have to call back multiple times? And so these are all things that your AI agent should also be able to mirror and provide that. Because again, the task managing that inbound call volume is still the same task. So you want to be able to measure it in the same way that you are currently doing in your call center and see how the AI agent is helping to improve or offset those metrics.
Right. And this all sounds fantastic and it's wonderful. And I'm sure there's like that one burning question in the back of everybody's mind. So what does this cost? Can you give us just some examples of what an AI agent in a call center might cost the organization?
Yeah, absolutely. I think, we talked about tight budgets. And so it is really important to be more fiscally responsible than ever, right? Knowing that we have less, how do we really make decisions that are going to have the greatest impact in our organization? And so when we look at the national data on the cost of a bilingual FTE in a call center, it averages around $40,000. And so that person that is there day in and day out taking calls, the average call volume for an inbound call center agent is between 80 and 100 calls a day, right? That's a normal performance. Translates into about $2 per call at the end of the year using that data. If you take that same data, an AI agent is handling those calls at less than 50 cents a call. So it's really a profound savings when you're looking at that same call volume and being able to improve those metrics, reduce wait times, reduce abandonment rate, improve patient experience, just to get that information quickly without having to sit in that long call queue.
Yeah, this is great. And I know we're starting to bump up on time here. We've covered a lot of ground today, everything from generative AI to agentic AI, how to train your AI, how it works, how to implement it, who might manage it, some of the costs associated with it, the benefits of it. So what are some of the key takeaways that you would like folks to leave with today?
Well, I think at the end of the day, it's really important that whatever especially technology tools or any new implementation, you want to evaluate how is it actually working. And so I do want to just share some data with you that are from actual users of this agentic AI solution. And so this first one is from a FQHC, a large FQHC with about 10 locations. And when they first implemented their agents, first month, there was just under 50% of calls were handled without having to be transferred to a live agent. Within 90 days, that number jumped to over 70% of their calls. In that same FQHC, their Spanish AI agent, so they have Mary and Maria. Maria increased from her baseline of those calls that were handled end to end without having to be transferred, 61% in that same time period in 90 days. And so what that really tells us is the AI agent is able to answer the questions, provide resolution for the patients, and the patients are able to get that without saying, please transfer me to somebody. And so that's really exciting data. The abandonment rate across a number of our FQHCs that are using this solution has decreased, some as high as 40%. So really exciting. And I met with a work group that has some of the call center agents. And so they didn't have data, but they were just speaking to what their experience was. And so they noted that there was a noticeable reduction in those repetitive conversations, right? So it just felt better to them at the end of the day. Somebody else said the phones are no longer ringing off the hook. And so I think that's really exciting, right? When we talk about staff retention and making sure we're taking care of who we have, that qualitative data is just as important.
Yeah, that's amazing. I mean, those numbers are really pretty remarkable when we think about like how new this is, and we begin to think about really what the impact could be across organizations. It's pretty profound, really. And I love that we can sort of name our AI agents too. That's kind of a fun thing to do too, and we can make it very culturally responsive, right, for our patients as well to experience that. And if you put in the subject line